At the beginning of 2020, no one knew we would become a part of a historic event, the COVID pandemic. In March 2020, what started as a series of lockdowns turned into massive suffering around the world. In India, we witnessed heartbreaking cases of migrant laborers returning to their hometowns, small vendors losing their livelihoods, and shutdown of educational institutions and offices. There was an invisible terror, COVID, which led to widespread anxiety and confusion. The country was in desperate need of help, and we at Youth for Seva doubled our efforts to help our fellow countrymen in whatever way possible. Youth for Seva is a nationwide volunteering movement, and we inspire youth to volunteer and provide them with meaningful opportunities to serve the community. During these trying times, we worked alongside multiple stakeholders, including governmental bodies, hospitals, schools, colleges, NGOs, and volunteers across India. We conducted distribution drives for masks, face shields, and sanitizers to the regions in need. More difficult than fighting the disease is to fight the fear around it. We conducted multiple awareness campaigns online and offline to tackle misinformation. Our volunteers took hundreds of calls every day across India and helped people stay safe in their homes. Additionally, our doctor volunteers worked day and night to attend to the worries of the people and comforted them like family. To support our frontline workers, we supported Adamya Chetana in their Annadan project that provided fresh meals to essential workers in hospitals. The complete lockdown was also affecting poor animals who were dependent on people for food, and our volunteers compassionately helped stray animals get food. When the Karnataka government decided to conduct the SSLC exams, there was confusion and panic among students and parents alike. Our brave volunteers took the responsibility and screened over 84,000 students and 6,000 teachers to make sure the exams were conducted properly. The second wave was way more disruptive and intense compared to the first one. It reached remote corners of the country and overwhelmed our healthcare system. There was a lack of beds, medicines, and ventilators. In this heart-wrenching situation, our volunteers assisted people through teleconsultations and counseled more than 75,000 people. Through blood donation drives, we were able to engage over 900 volunteers across India. We identified areas where daily wagers and underprivileged people were stranded and distributed groceries and cooked meals to them. As the frontline workers were bearing the burden of everything, Adamya Chetana's Annadan project was extended for the second wave, and along with Chefs Aporta, we supported the distribution of over 140,000 fresh meals across hospitals in Bengaluru during the lockdown. Since isolation at home could reduce visits to hospital, we launched home care kits distribution. It contained all necessary medicines and equipment for treating mild COVID symptoms at home. With the help of around 2,000 volunteers, we were able to reach over 12,000 people in need. As some families had trouble isolating at their home, we supported Rashtrothana and Seva Bharati's initiative of initiating isolation centers in rural areas far away from hospitals. The aftermath of pandemic is a greater issue that needs to be tackled. Through our volunteers, we have supported vaccination drives across multiple locations. Going ahead, addressing the need of the hour, we are exploring partnership with multiple partners to conduct vaccination drives across the country. Another issue is that a huge number of children have lost their parent or parents to COVID, and due to financial instability will have to take up daily wage employment. To ensure that such families transition out of this pandemic with minimal damage, we have come up with the Vidya Chetana Alamban project that will support the education of these children and provide emotional support to their family. To generate awareness and funds for this project, a mega event Suryathon was conducted. Throughout the pandemic, over 7,800 brave volunteers have travelled thousands of kilometers to various corners of our country and helped us in conducting multiple activities and selflessly kept others' lives before them. Due to the astounding support from our volunteers, well-wishers and corporates, so far we have been able to touch over 9 lakh people across India.